In the next few minutes, we'll show you what cataracts are and how they can be treated with surgery. We'll talk about some of the types of lenses that can be implanted, some risks of surgery, and what you can expect afterwards.
In the healthy eye, light rays enter through the clear cornea, pupil, and lens. The light is focused directly onto the retina, the light-sensitive tissue lining the back of the eye. The retina converts light into electrical signals which travel through the optic nerve to the brain, where they are recognized as images. Cataracts occur when the lens inside the eye becomes cloudy. The cataract blocks light entering the eye and causes blurry vision. It usually happens slowly, over a period of years, as we get older. When cataracts interfere with your daily activities, such as reading, watching television, or driving, surgery can usually improve your vision.
I've been having trouble knitting and reading. I can't even watch television. And I don't feel comfortable driving at night anymore. It's really frustrating.
Patients with cataracts who do not have problems with their vision can safely wait to have surgery. An exam by an optometrist may show whether your vision can be improved with glasses or contact lenses. The goal of cataract surgery is to help you see better when glasses no longer help.
Now that you know how cataracts can affect your vision, let's cover what is necessary to prepare for surgery.
Your eyes will be measured to determine the power of the lens to be implanted after the cataract is removed. It's called biometry. If you normally wear contact lenses, please do not wear them for at least 1 week before this test, so that an accurate measurement can be taken. Once you are booked for surgery, you'll receive some information in the mail. This will include the date of surgery and a visit with your surgeon before the procedure, known as a preoperative or pre-op appointment. After your surgery, you will have 1 or 2 post-op appointments, including a final visit with an optometrist. There will be co-pays for each of these visits. It's a good idea to plan on staying in town for the first week after surgery. If you have any conflicts with these dates, please call our office right away. If you will be having surgery on both eyes, the second eye will be scheduled 1 to 2 months after the first eye, so that the first eye will have time to heal. At the pre-op appointment, you'll have a chance to discuss your lens options with your surgeon and to ask any questions about the procedure. Your doctor will send an electronic prescription for eye drops to a nearby Kaiser Permanente pharmacy. Carefully follow all directions listed on the label. After this visit, any changes that you would like to make to the planned lens or surgery should be discussed directly with your surgeon. You won't need to see your regular medical doctor or take additional lab tests unless you've experienced a recent change in your health. If this is the case, please notify our office. You also won't need to stop aspirin or other blood thinners, such as Coumadin, unless advised by your doctor. You will know the date of your surgery from the mailed information, but the exact time of your surgery won't be known until 1 or 2 days before. You'll get a phone call advising you when to arrive at the surgery center. Don't worry if you're not home. We'll leave the time to report to the surgery center on your answering machine or voicemail. You may eat and drink up to 6 hours before your surgery appointment. After this, please don't take anything by mouth except necessary medications, like blood pressure and heart medicines, and take them with a small sip of water. If you are a diabetic, however, do not take your diabetes pill or inject insulin on the morning of surgery since you will be fasting. You'll need a responsible adult to drive you, stay with you, and drive you back home from the surgery center. Wear comfortable clothes, no facial makeup, and leave your jewelry at home. The actual operation only takes about 15 to 30 minutes, but be prepared for a 3-hour total visit, as there are many steps involved in preparing for your surgery. You'll receive IV medication to help you relax without putting you fully asleep. You'll also receive some drops, which will numb the eye. During the operation, we'll ask you to lie quietly and stare into a light. Your surgeon will make a small opening in the side of your cornea and on top of the cataract. Ultrasound is then used to liquefy the cataract and then vacuum it out. A foldable lens implant is then placed into a clear bag called the capsule, where it unfolds and remains permanently. Your surgeon will then place a shield over your eye to protect it overnight. After surgery, you'll receive instructions on the care of your eye. Please read these carefully. Most patients are able to resume their usual activity, including driving, within a few days.
It was much shorter than I expected, so it wasn't as bad as I thought it would be.
No pain at all. Feel good. I wish the other one was done.
Your vision should improve during the first week, but some patients may take a little longer to heal. Everyone's a bit different. It's normal for your eye to feel a little scratchy for a while after your surgery, but you should call right away if you notice pain in your eye, redness, or worsening vision, especially during the first week or two. It could be a sign of a serious infection.
Before we talk about your lens implant choices, let's first take a look at what happens as we age and we lose the ability to focus at different distances. It's called presbyopia.
In younger people, a tiny muscle inside the eye can make the flexible lens change shape. This change in shape allows us to see things up close. As we age, our lens becomes less flexible and stops changing shape, so we lose the ability to focus up close. This is called presbyopia. Presbyopia is the reason why we need reading glasses or bifocals when we get older. The standard lens implant, which is included in your surgery, is made from a crystal clear synthetic material and is chosen for you based on your biometry eye measurement. This lens focuses at only one distance. Most patients who choose the standard lens want the lens focused for far vision, for things such as watching television and for driving. Patients with cataracts in both eyes usually choose to have each eye matched for far vision. This means that you will need to wear reading glasses for up-close vision. Patients who have astigmatism will need glasses for both near and far vision with the standard lens implant. Astigmatism means that the cornea is oval-shaped, more like a football than perfectly round. Glasses and contact lenses are a common way of correcting for astigmatism. Now, there is a lens implant available for an additional fee that can correct astigmatism. It's called a toric lens. Toric lenses are made from the same material as standard lenses, but are shaped so that they can correct for astigmatism. If you have astigmatism, the toric lens offers you the best chance of seeing clearly without glasses at a single distance.
Now that you know about correcting your vision for one distance, let's take a look at how you can choose to correct your eyes for more than one distance at the same time.
The first way to correct for more than one distance is using a technique that has been used for years in contact lens patients called monovision. For cataract surgery, one eye is corrected for far vision, and the other eye is usually corrected at arm's length vision, at about the distance of a typical computer monitor or a menu. This takes a little getting used to, but in a few weeks, the brain is able to combine the two images together. Because your depth perception will be somewhat affected, monovision is not the best choice for everyone. The second way to get both far and near vision is by implanting the multifocal lens, available for an additional fee. It's a special lens that focuses some of the light rays coming into the eye for far tasks and some for near. Each eye receives this lens, and each eye is able to focus at far and near. Multifocal lenses in both eyes offer more balanced vision than monovision. It takes a few weeks after surgery in both eyes to get used to the multifocal lenses. Some patients experience mild symptoms of glare at night. If you require very precise vision, or if you don't mind wearing glasses, then these lenses may not be the best choice for you.
While cataract surgery is successful in the vast majority of patients, it's not risk-free. Changes in your vision can occur days, weeks, months, or even years later.
There is a chance that you will need a small prescription for glasses to get the sharpest vision. Occasionally, a film develops on the bag or capsule holding the lens implant. You'll notice it when your vision gets a little blurry, months or years after surgery. A simple in-office laser procedure, called a YAG, can correct this. Another, less common risk of surgery occurs when the bag or capsule holding the lens tears during surgery. In this case, your surgeon may need to implant a different lens than the one planned, so that it will safely remain in position. Your eye may also heal a little more slowly. In most cases, however, the final result is excellent. Other more serious risks of surgery include the possibility that cataract pieces could be left behind after surgery. The lens implant might slip out of place. The retina could detach. Or you could develop a serious infection of the treated eye. Some problems may require another surgery, and rarely, permanent vision loss or blindness may result. If you have other conditions affecting the vision in your eye, such as macular degeneration, glaucoma, or diabetes, cataract surgery alone may not be able to restore full and complete vision. You may also choose not to have surgery. Cataracts develop slowly, and waiting to have surgery later on, when your vision is more affected, will not usually decrease your chances of a successful surgery. The good news is that in most cases, cataract surgery offers a fast, painless way to improve your quality of life.
The surgery was much easier than I thought. I didn't feel a thing. My eye was a little scratchy for a little while after the surgery, but I'm very glad with the decision to do it.